Now, there's a common question that gets asked frequently, which is how come like the adjustments are done so quickly, and also why not all adjustments all done at once? Okay. Now, the simplest way to answer with this would be that it depends on patient to patient. There's like we get all sorts of different cases coming into the clinic, and so the variety is huge, and so we really have to tailor specifically the treatment according to the patient. Okay, so let's say someone who comes in is having a lot of headaches or a lot of low back pain. If we adjust all of those segments, like for example 5 or 6, 7 segments all at once, it can potentially make the problems a lot worse. Okay, so especially when it's chronic, okay, and especially when the patient is very sensitive, okay, so which means that the more that we do, a lot of times it means that there's more input into the nervous system, which means that there's more processing which needs to be done by the brain, okay, and that can potentially cause them to be even more pain. That's why we always, at the beginning, especially the first 3 adjustments, always start from a base, for example, 1 or 2 adjustments. And once that's done and they can cope with it, then we can add to those adjustments later on. It's more of, it should be like a steady base. We've got to make sure that the foundation is set, for example, the low back. So let's say someone comes in with a combination of low back pain, mid-back pain, especially at the base of the neck, also upper neck pain. Everything is painful. If we adjust all of those 4 or 5 segments all at once, it can definitely make them a lot worse. Okay, it's just too much stimulation to the nervous system. Okay, so what we want to do is we want to ideally, especially the first 1 or 2 adjustments, make sure that they can handle the adjustments. So what I'll usually do is adjust the lower back, make sure that the foundation is set. Okay, and then whichever one is worse up in through here, I'll most likely adjust that one, but not 4 or 5. This is way too much. And a lot of times you'll find that if, for example, a patient comes in for low back issues, but they've had chronic neck issues, but it's not too painful at the present time, or they don't have like headaches now, but they used to, or vertigo before, for example, but they used to. If we adjust low back, we adjust here, we adjust here, we adjust here, it can potentially set them off, which means that they can start to get the vertigo back, they can start to get more dizziness, they start to feel nauseous, for example. Now, in terms of time of adjustment, it varies a lot from patient to patient, depending on the patient's case, okay? So let's say, for example, someone has like neck pain, for example. We won't always necessarily adjust the neck, okay? We can look at other areas. And a lot of times the neck pain can be coming from either above or below, okay? And so it's one of those things where in terms of time, it really varies. It's you know, sometimes it can be very quick because it's only one segment that we need to adjust. Sometimes it can take a little bit longer because we need to look at like finding out which other areas are potentially causing that problem. So don't be surprised if the adjustment is only one, okay, one specific area.